Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
So, nephrotic syndrome we have and other hypoalbuminemic states. Nephrotic syndrome and other hypoalbuminemic states, these include here in nephrotic syndrome, the first or primary alteration in nephrotic syndrome is due to decreased or diminished colloid oncotic pressure is the primary alteration. First, because of this decreased oncotic pressure. Now, why is there this decreased oncotic pressure? This decreased oncotic pressure is mainly due to the loss of large quantities of protein is lost. Due to loss of large quantities of protein in urine, there is diminished colloid oncotic pressure is seen. Now, because of this diminished colloid oncotic pressure, sodium chloride and water, so sodium chloride and water are not retained in the vascular compartment. So this will result in decreased total or effective blood volume. So in the nephrotic syndrome, the decreased total or effective blood volumes is seen. So because of decreased blood volumes, renin, angiotensin, aldosterone system is activated, and thus there is impaired renal function is seen. This impaired renal function is mainly contributed by, because of this there is edema is also seen in the patient.
thank you and thank you for watching.